Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, and today I want you to know I am not a stalker. I just want to go where you go, see what you see, and do what you do always. This is my little stalker. This is Cooper. He goes everywhere I go. He won't leave me alone. I can't go anywhere without him, right, Cooper? Is that right, buddy? It's like he's going to have a heart attack. Oh, there we go. There we go. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews. Today we're going to be doing orthopedics and select all that apply questions. I looked back to see what I've covered in the past, and I have not covered any orthopedics, at least not intentionally that I can tell. So I'm going to go ahead and do SATA questions. I haven't done SATA questions in a while. Most of my SATA videos are pretty old. And so I want to start to update some of these SATA videos. So let's go ahead and get started. Now, one of the things that I always like to teach you about SATA questions is not just the information that you need to know to get them right, but how to answer them. And you always treat SATA questions like a series of true false statements, and you say true or false. And then you have to relate the answer to the question. So make sure you're relating the answer to the question. Even if the answer seems like a good NCLEX answer, if it doesn't specifically relate to the question, you don't want to pick it. Okay, so let's go ahead and get started. We'll talk about how to answer SATA questions. A nurse is providing discharge teaching to a patient who has undergone a total hip replacement. Which of the following statements require further teaching? Further teaching. So we're looking for the false statement. So let's read the answers. Then we'll read the question again, and then we'll read the answers again. I should avoid crossing my legs at the knees. It is okay to bend at the waist to pick up objects. I will use a raised toilet seat to avoid bending too much. I can resume driving as soon as I feel comfortable. Using a pillow between my legs while sleeping is recommended. I should avoid sitting in low chairs, and I can start jogging to build strength in my hip. All right, total hip replacement, false statement. So going home after total hip replacement, I should avoid crossing my legs at the knees. That's true. That's like the one thing I do know about hip replacements, y'all, is you can't cross your legs. Okay, so adduction is bringing your legs together. Adduction is bad. Abduction is good. So you want to abduct. That's why we put an abductor pillow between the legs. Okay, so A is true. It is okay to bend at the waist to pick up objects after total hip replacement. That's false. It's never okay to bend at the waist to pick up objects, even after total hip replacement. So no, I'm not going to all of a sudden change what I teach about good body mechanics just because they've had a hip replacement. So B is false. C, I will use a raised toilet seat to avoid bending too much after a total hip replacement. Yes, that is also one thing I know. You can't bend too much after total hip replacement. So a raised toilet seat is a good idea. So that's a true statement. I can resume driving as soon as I feel comfortable after total hip replacement. Well, that's not true. So we've talked about this in previous videos. But if you don't know how long the post-op restrictions should last, then you should guess 6 weeks. And post-op restrictions include lifting, driving, going back to work, and so forth. And so I'm going to say, nope, they're going to have to wait at least 6 weeks before they can start driving. And I would not even know if that may not even be long enough for total hip replacement. Let's see. Using a pillow between my legs while sleeping is recommended after a total hip replacement. That's true. That's what we call the abductor pillow. They can just use a pillow. They don't have to use an abductor pillow, but a pillow between the legs is good. I should avoid sitting in low chairs after total hip replacement. Well, that's the same reason we use a raised toilet seat. So that's a true statement. I can start jogging to build strength in my hip after total hip replacement. False. That would be included in the post-op restrictions that are going to last at least 6 weeks and probably longer after total hip replacement. So definitely not going to start jogging. So which ones are the false statements? B was a false statement. It's okay to bend at the waist. D was a false statement. I can resume driving. And G was a false statement. I can start jogging to build my strength. So those were the false statements. So remember, further teaching means a false statement. A patient with a newly applied plaster cast for a fractured tibia is receiving instructions from the nurse. Which of the following statements require further teaching? Let's read the question answers, and then we'll read the question again, and then we'll answer it. I should keep my cast dry at all times. I can scratch under the cast with a long object if it itches. I should elevate my leg to reduce swelling. It is normal to experience severe pain and numbness. I should apply ice over the cast to reduce swelling. I can bear weight on my leg as soon as the cast is applied. I will call the doctor if I notice any foul odor coming from the cast, and I should refrain from wiggling my toes until the cast is removed. All right, after a plaster cast is applied, which require further teaching. So we're looking for the false statement. So I should keep my cast dry at all times is a true statement with a plaster cast. Okay, plaster cast should keep the cast dry at all times, true. With a plaster cast, I can scratch under my cast with a long object if it itches. So this is one that I wanted to make sure you know they cannot do that. It sounds like a good idea. I got a pencil. I can start scratching under my cast because it itches. That's actually not true. If it causes any skin breakdown, then you can lead to an infection and you're not even going to know it until the cast comes off or you just have pain and stuff. So no, you're not supposed to scratch under it. There's a couple things you can do. You can apply ice over the cast. You can, like, if the cast is here, I can scratch up here and see if that doesn't help stimulate it. I can put pressure on it, so you can just press on it. Sometimes that helps. You can blow cool air on it or blow cool air up it. Sometimes that helps. Those are options, but putting something under it to scratch with is not considered best practice. So B is false. With a plaster cast, I should elevate my leg to reduce swelling. Well, that's true because you don't want it to swell and constrict because you got a plaster cast on. And so if it swells, it's going to constrict blood flow. So elevating it is a true statement. It is normal to experience severe pain and numbness. Well, that's false, y'all. You have an extreme word in there, severe pain. It's never normal to experience severe pain and numbness. Okay, that's never normal. So that's a false statement. I should apply ice over the cast to reduce swelling. That's exactly what you should do to reduce the swell. Elevate and rest, ice, compression, elevation are what are used to treat musculoskeletal injuries. Rest, ice, compression, elevation. So we can't compress because we've got a plaster cast. We can rest it, we can ice it, and we can elevate it. So we can definitely do the ICE. No, we can do the R, I, and E of rice. So E is a true statement. I can bear weight on my leg as soon as the cast is applied. So remember rice, rest, ice, compression, elevation. So no, we're not going to put weight on it immediately. We're going to rest it for however long the doctor tells us to. It takes at least 2 weeks for the new bone to start to appear. And so it's going to be at least 2 weeks before they can put any weight on that. And probably it's going to be longer depending on what the surgeon says. So F is false. I will call the doctor if I notice any foul odor coming from the cast. Well, that's always a good idea. So G is true. H, I should refrain from wiggling my toes until the cast is removed. Well, that's false. Wiggling your toes is fine. It stimulates circulation, all that. So there's nothing wrong with wiggling your toes. So H is a false statement. So further teaching is false statements. So the false statements were B, I can scratch under the cast. D, it is normal to experience severe pain and numbness. F, I can bear weight on my leg. And H, I will refrain from wiggling my toes. So those are the false statements. So again, I have made this mistake before. People have seen me make this mistake, even on videos that I've posted because I didn't realize I'd made that mistake. Okay. So it's so easy to accidentally choose the true statements rather than the false ones. So we're going to do one more of those. Okay, nurse is teaching a patient with osteoporosis about lifestyle changes to prevent fractures. Which of the following statements requires further teaching? All right, osteoporosis is the loss of bone density. So we want to prevent fractures. So we want to promote increasing bone density to prevent fractures because osteoporosis is the loss of bone density. And how else can we prevent fractures? Well, I guess injury. We want to prevent injury and we want to promote increases in bone density. So let's see what the answers here are. I could use throw rugs in my home to prevent slips. I will increase my intake of calcium-rich foods. I should avoid weight-bearing exercises to prevent injury. I should avoid sunlight to protect my skin. I will quit smoking to improve my bone health. Drinking alcohol in moderation is acceptable. And I will take my prescribed vitamin D supplements regularly. All right, we're looking for false statements related to bone density and preventing fractures. I can use throw rugs in my home to prevent slips. Okay, that's a false statement as it relates to injury. Throw rugs increase your risk for injury. falling, increases your risk for falling, throw rugs do. So that's a false statement. I will increase my intake of calcium-rich foods. Increasing calcium-rich foods helps promote bone density. So that's a true statement. I should avoid weight-bearing exercises to prevent injury. I should avoid this is this is a strangely worded answer. I should avoid weight-bearing exercises to prevent injury. Well, no, weight-bearing exercises increase bone density. And weight-bearing exercises don't do anything to cause injury. So there's no reason to avoid weight-bearing exercises because that's good for people with low bone density. So C is a false statement. D, I should avoid sunlight to protect my skin. Okay, that's false because sunlight provides vitamin D. Vitamin D is required for calcium to be absorbed into the bone. And so sunlight actually helps increase bone density. So D is a false statement. E, I will quit smoking to improve bone health. It's always good to quit smoking, y'all. So I'm going to say true to that one. F, drinking alcohol in moderation is acceptable. There's nothing that I know of that says drinking alcohol in moderation is bad for the bones. I don't know of that at all. So I'm going to say F is true. G, I will take my prescribed vitamin D supplements regularly. Well, taking vitamin D is the same as being exposed to the sun. And I said being exposed to the sun is good. So taking prescribed vitamin D is also good to help promote absorption of calcium. All right, so let's see. A nurse is teaching a patient with osteoporosis about lifestyle changes to prevent fractures. Which of the following statements require further teaching? So I'm looking for the false statement. So which were false? A was false. I can use throw rugs in my home. Uh, C was false. I should avoid weight-bearing exercises. D was false. I should avoid sunlight. I think that was it. Yeah, that was it. Only those three were the false statements. All right, next question. We're done with the further teaching questions now. Okay, now we're going to talk about nursing actions as it relates to orthopedics. All right, a patient with a fractured femur is admitted to the ED. The nurse notes that the patient's leg is swollen, painful, and has a decreased pulse. Which are the priority nursing actions? So when we said, remember when we were talking prioritization strategies, and we said if you have one patient and the symptoms are all in the question and they say, what's your top priority? You always address the objective finding first, right? The objective finding. Well, here we have a SATA question. So we don't have to prioritize one, which means, y'all, we're going to address all the problems in the question. So if they have a fractured femur, we're going to look for answers that address the fractured femur, that address swelling, pain, and decreased pulse. Now, why do you think, if they have a fractured femur, why do you think they have a decreased pulse? So you have to evaluate the scenario. I've said this when we did the maternity questions. And with maternity, I'm a little bit more meticulous about it because I'm not a maternity nurse. So I always have to intentionally read the scenario and go, okay, what's going on here? And let me evaluate it. I have a tendency when I read med surg questions, because I'm a med surg nurse, to skip over, like go through it too fast. And I can't avoid evaluating the question. So what's really going on? Well, they have a fractured femur, swelling and pain. So why is the pulse decreased? It's because of the swelling, y'all. The swelling is compressing the vessels, and it can lead to compartment syndrome. If you've never heard of compartment syndrome, look it up. But it can lead to compartment syndrome. That's such severe swelling that it completely occludes all circulation, right? So I need to watch for that. So how can we reduce swelling, reduce pain, and let's see what else there is. Okay, so that's what I'm thinking. Administer prescribed analgesics for pain relief. Well, that's going to address the pain. Okay, so I like that. Elevate the affected level above heart level. Well, that's going to help with the swelling. Now, my first thought was, well, but they have a decreased pulse. So why would I elevate the leg when they have a decreased pulse? And we elevate the leg because it's the swelling that's leading to the decreased pulse. So yes, that addresses the swelling. Apply ice packs. Rest, ice, compression, elevation. Well, I don't want to do compression here because we have a fracture. So I don't want to do compression, but resting is fine. Ice is good and elevation is good. So I can't forget rice when I'm doing orthopedics. Okay, so elevate, yes. Ice, yes. Okay, that's all rice. Prepare the patient for immediate surgery. Well, I don't know that they're going to need surgery. They may just need a cast. I don't know. So I'm not going to prepare them for immediate surgery because I don't know that's what's going to have to be done. Perform neurovascular assessments frequently. Well, neurovascular means checking pulses and checking for pain and sensation. Remember the 5 P's: pain, paralysis, paresthesia, poikilothermia, which is coolness, pallor, and there's one other P, and I don't know what I just said. So anyway, there's one other P, but that's a neurovascular assessment, okay? So those P's. So yes, I'm going to absolutely do that because that's their problem. Immobilize the affected leg to prevent further injury. Well, they have a fracture. So rest, ice, compression, elevation. I'm not going to do compression, but I'm going to rest it. So immobilizing it is a good idea because they have a fracture. Reassure the patient, explain all procedures. That seems like a good idea. That just makes sense, doesn't it? Don't throw your common sense out the window, y'all. Monitor vital signs and assess for signs of shock. Well, yeah, that seems like a good idea. I mean, why not, right? That just seems like a good idea. You say, well, they have a fracture. Well, but they may be bleeding. I don't know. So yeah, that seems like a good idea. So administer pain medication for the pain. We're going to elevate, ice, and rest. So A, B, C, and F all go with rice. Immediate surgery is not necessary. Neurovascular assessments are good. Immobilizing, that's rest. Reassure the patient, that's just common sense. And monitor vital signs, that just makes common sense. Y'all, that just makes common sense. So this was basically a rice question: rest, ice, compression, elevation. And we addressed any other symptoms that the question told us they had, like pain. So of course I'm going to manage pain. And then the common sense answers, like monitor neurovascular assessments, monitor vital signs. These just make sense. Okay, just plain common sense. 5, a nurse is caring for a patient who has just undergone spondylodesis. Yeah, I'm testing whether you watched my suffixes video, number 2, that I posted at the time I'm recording this. I posted yesterday. So suffixes, the endings of words, I taught you desis, which is fusion of, fusion. Desis is fusion. Spondylodesis is spinal fusion. So they just undergone spinal fusion surgery, which is a major surgery. All right. The patient reports severe back pain. Okay, I'd never expect severe anything after surgery. That's just not, no, I don't expect that. And difficulty moving their legs. That's not expected either. So unexpected findings, y'all, I have to do something. What are the priority nursing actions? Okay, now if you've taken the clinic review, you've learned something really important. And what you learned is cervical, thoracic, and lumbar. And you learned cervical is in the neck, thoracic is in the mid back, lumbar is in the low back, lumbar, low back. And you learn that the nerve roots that exit the lumbar area control the lower extremities and the urinary sphincters. So if they're having difficulty moving their legs, even though it did not tell me that this surgery was in the lumbar area, do you know what area I think it's in? I think it's in the lumbar area because they're having difficulty moving their legs, which is a complication after lumbar surgery. All right, so that's all stuff I have in my head as I'm getting ready to answer these questions. This is why I tell you the clinic review is so valuable, y'all. All right, A, administer prescribed pain meds. Well, they're having severe back pain. That seems like a good idea. Assist the patient in changing positions frequently. Well, they just had back surgery. They just had it. It says just undergone. I'm not that crazy about frequent turning because there's one thing I know about back surgery, and they have to lay flat totally and log roll, lay flat and log roll. So I'm not crazy about frequent turnings and changing positions after back surgery. See, assess the patient's neurologic status in the lower extremities. Well, that seems like a good idea. They're having difficulty moving their legs. So that seems like a good idea. Encourage early ambulation to prevent blood clots. No, not when they're having difficulty moving their legs. That doesn't make any sense. Apply heat packs to the surgical site. Well, what is our treatment for musculoskeletal injury? Rest, ice, compression, elevation. What reason would we apply heat? Don't know. I can't think of a reason I would apply heat. I can't think of a reason I would do the opposite of what I know is common treatments for musculoskeletal injuries. So I don't like E. Notify the surgeon. Absolutely, y'all. Absolutely. They should not be having severe pain and difficulty moving their legs. Even though I gave them the prescribed pain medicine, don't say, well, you got to wait and see if the pain medicine works. Well, what about difficulty moving their legs? Like that's a serious problem, right? So I got to notify the surgeon. Monitor the patient's intake and output. Why would I want to do that? I told you about the lumbar nerve roots that exit the lower back, and they control what? They control lower extremity movement and urinary sphincter. Do you think it would be a good idea to monitor intake and output since we probably have a lumbar issue? I think so. Educate the patient on activity restrictions. Y'all, they just came out of surgery and they're having complications. This is not the time to educate the patient. If we think about good teaching and learning strategies, you don't educate patients in the middle of a critical time. Like that's not a good idea. Okay, so we're looking for I'm going to reread the question, make sure I didn't miss anything. A nurse is caring for a patient who's just undergone spondylolisthesis. The patient reports severe back pain and difficulty moving their legs. What are the priority nursing actions? Okay, good. So I said we should administer pain medications, assess the patient's neurological status, notify the surgeon, and monitor the patient's intake and output. And those are the correct answers. Good thing they're the correct answers since I wrote the question. All right, question 6. This is the last question. A patient with osteomyelitis is admitted for IV antibiotic therapy. The nurse observes that the patient has a fever, chills, and increased pain at the infection site. What are the priority nursing actions? All right, so I have to evaluate the clinical scenario here. I have to use good clinical reasoning and see what I think is going on. Remember, NCLEX is about good clinical reasoning and prioritization. When you have a SATA question, you prioritize interventions, but you don't have to decide what's first, second, third, and you can pick more than one answer. So that's why prioritization questions with SATA are different than prioritization questions when you can only pick one answer. So what I have to do when I prioritize SATA questions, I have to say, well, what's the problem? I have to address the problems in the question. So they're admitted for IV osteomyelitis. Okay, osteomyelitis is an infection of the bone. Itis, the ending itis, remember we did suffixes, we haven't done itis yet. Itis means inflammation of. So we've got an inflammation, which could lead to swelling and infection of the bone. That's what osteomyelitis is, which is why they're being admitted for IV antibiotic therapy. But they have fever. That's expected with osteomyelitis. Chills. That's expected with osteomyelitis. And pain is expected, but this has increased pain. Y'all, this is a changing assessment. And the NCLEX wants to know if we realize that a changing assessment is something that has to be addressed. So let's look at our answers. Administer prescribed antibiotics as scheduled. What are the priority nursing actions? Well, yeah, they're admitted for antibiotic therapy, so I better do that. Perform a thorough pain assessment. Well, they're having increased pain. I'm going to do a thorough pain assessment. Elevate the affected limb. So here's the question. Why would I elevate the affected limb? Well, it's osteomyelitis. This is why knowing your prefixes and suffixes is a good idea. Itis means inflammation. What do we do when something is inflamed or has the potential to swell? We elevate it or compress it. You can't compress it, it's the bone, but you can elevate it. Now, if you're like, oh, Sharon, I didn't get this one. Okay, it's not the end of the world if you didn't get this one. That's why I'm teaching you this. On the NCLEX, the good news is that you get partial credit for SATA questions. So if you miss it, it's not the end of the world, but it would be appropriate to elevate it. Apply a warm compress. Y'all, musculoskeletal problems are rest, ice, compression, elevation. Why would we do a warm compress? That's going to pull blood into the area, which is going to cause increased swelling. I don't want to do that. Obtain a blood culture before administering antibiotics. That seems like a good idea since they have increased pain at the infection site. I think that's a good idea. Now you might say, well, don't you need a doctor's order for that? Well, yes, but it's still a good option. It's still a good idea. And I'm not going to say, well, I'm not going to do it because I don't have a doctor's order. That's not what I'm going to say. I'm not going to tell the National Council of State Boards of Nursing that. The National Council of State Boards of Nursing wants to know if I know what I should be prioritizing. And I want them to know that I realize that the fact that it has increased pain means I better see if they've gone septic. Remember, Septicemia, emia is of the blood. Septicemia is infection of the blood. And how do we determine if they have infection of the blood? We do blood cultures. Encourage increased fluid intake. Well, what would that treat? Is that going to treat the infection? No. Is that going to treat the fever? No. Is it going to treat the chills? No. Is it going to treat the pain? No. So there's no reason. Remember, there's going to be answers that are like, well, that's a good idea. But if it doesn't address the problem in the question, don't pick it. G, notify the healthcare provider. Absolutely. They have increased pain. It's a changing assessment. I want to notify the healthcare provider. Now, if it said fever, chills, and pain, I would not notify the healthcare provider because fever, chills, and pain are the expected findings for osteomyelitis. The reason I'm notifying the healthcare provider is they have increased pain. That's a changing assessment. Educate the patients on the importance of completing the antibiotic course. Y'all, they were just admitted. We're starting them on IV antibiotics. This is not the time to educate them on the importance of completing antibiotic course. Discharge, I would do that. I would maybe start teaching them that a couple days before discharge, but not on admission. That's a little early. Okay, so those are the correct answers. All right, so that's it. I hope you found that helpful. Another SATA video. And remember, I am not a stalker, but my dog is. Have a great rest of your day.